Hi everyone. So I'll share some very important points related to hypoglycemia. So hypoglycemia is decrease in level of blood sugar, as you all know. But for management purposes, we differentiate into three types: level one, two, and three. So level one is when glucose is less than 70 milligram per deciliter. Level two is when glucose is less than 54, and level three is any hypoglycemic event which is characterized by severe clinical features such as altered mental status, seizures, or any other severe feature. So, for management, the level 1 hypoglycemia is usually easily managed by eating glucose 15 to 20 gram or any other carbohydrate containing substance as long as the person is conscious. So, beware as eat only when the person is fully conscious because there's a risk of aspiration if there is altered mental status and you eat in such a situation. And after eating you should try to check the sugar again after 15 minutes, and if the blood glucose level has not increased then you should eat again. And for level 2 and level 3 hypoglycemia, you need to consult your doctor and ask whether you need to carry glucagon with you. So glucagon is just a hormone similar to insulin, but it works completely opposite to insulin. So insulin decreases glucose in the blood, but glucagon increases the level of glucose in the blood. So whenever there is a level 2 or level 3 event, glucagon is very useful. So consult your doctor if you need to take it. And the most important thing is how can you prevent. So keep in mind, if someone has even a single episode of level 3 hypoglycemia or unexplained level 2 hypoglycemia, the glycemic target should be modified according to that individual, and it should be modified or increased for at least several weeks until the person is not at the risk of hypoglycemia anymore. And the most important thing which I need you to know today is hypoglycemia awareness. So normally hypoglycemia, whenever the person has decreased blood sugar, it is accompanied by two types of symptoms. So one is autonomic or neurologic or warning symptoms, I should say. So when the blood glucose decreases, the body gives the warning such as sweating, palpitations, tremor, hunger, or you may feel uneasy, anxiety. So these are all the warning signs that which tell you that the glucose in the blood has decreased and you need to eat something to increase it. And these warning signs are actually useful to prevent decrease in the glucose level in the brain. And if someone overlook these warning signs or not act upon them, then there is a neuroglycopenic state, which means the glucose in the brain is now decreased. In such a situation, the person may have seizures, loss of consciousness, hypotension, dizziness, or even coma. So the thing is that autonomic or warning symptoms always or generally occur before neuroglycopenic symptoms, and this is basically hypoglycemia awareness. But if this chronology is disturbed such that neuroglycopenic symptoms occur earlier or autonomic symptoms are completely absent, then this is known as hypoglycemic awareness, which basically means the person is not aware when the glucose in his body has decreased. So who is susceptible to hypoglycemia unawareness? Keep in mind, duration of diabetes is the most important risk factor which predispose to hypoglycemia unawareness. For example, a person who has 20 years of diabetes compared to a person who has just 2 years, then the 20 years person is more has more risk of hypoglycemia unawareness. And it is more common in type 1 diabetes because by definition it is more severe and starts from the an early age. And if a person has multiple episodes of hypoglycemia, then also he may develop hypoglycemia unawareness. This is just like the person's body has adapted to low level of blood sugar. Generally when blood sugar starts to decrease at a bit higher level, there are warning signs or autonomic symptoms, and when the blood sugar comes down to around 40 or less than 50, then neuroglycopenic symptoms start. So if a person has constant hypoglycemia or repeated episodes, then his body adapts itself to a low level of blood sugar of such as 70 or 60. So if it decreases furthermore, then neuroglycopenic symptoms occur directly. It can also occur in type 2 diabetes patients who have cardiovascular or neurological complications. So if anyone has such complication, then they should be aware of hypoglycemia. It can occur during or after exercise, because exercise is a physiologically different state when there's a lot of changes in the hormones in the body, and depending on your control of your blood sugar, it may decrease during exercise. Continuous blood monitoring systems are very useful in preventing hypoglycemia and awareness. And finally, I want to tell you about HbA1c goals. So generally, in adults, a goal of HbA1c about 7% or less is generally prescribed. But keep in mind, the goal should always be individualized. A person who has low life expectancy or is at very high risk of hypoglycemia, then the limit of 7 can be increased to about 8, or depends on the situation of the patient. So always talk to your doctor about that. Thank you.